Welcome to the Westin MCAT podcast with your hosts, Eric Olson
and Jayden Garcia.
All right, everyone, welcome back to another episode of the Westin MCAT podcast. I am your host, number one, Eric. I'm here with my friend, Jayden, your other host. It's been a minute since we've been together, I think, Jayden, on a podcast. And
yes,
today we want to talk. What's that?
He said, yes, it has. It's been a minute, man.
Yeah, it's about time. We want to talk a little bit, give you guys an update about what we've been up to for the last few months, and talk a little bit about kind of our experiences a little further along in the medical education pathway. But in fact, let's just kind of get into it. And I think I've been meaning to ask Jayden some questions about kind of how his experience has been, and he's been super busy, which is why we haven't seen quite as much of him, but he's got the scrub cap on today. He's wearing the surgical scrubs. What were you up to today, Jayden? Tell us kind of just immediate past, like last 24 hours what you've been doing.
I have been operating a lot.
That's great.
Taking care of kiddos. So I'm at the Peds hospital doing a lot of surgeries on little kiddos with lots of different problems. I'm also the consult resident for the kids as well. Yeah. So throughout the day, I will go see consults of various teams that need help answering questions to whatever clinical problems might arise for different kids throughout the hospital. So it's a lot at once to try and operate and see consults in the hospital. Stuff.
Yeah, that sounds like a lot. What kind of operations do you do for kids in the ENT service?
Oh man, I think that we in Peds ENT probably see the healthiest patients in the hospital and the sickest patients in the hospital. I truly believe that. Contrast it with like cardiac surgery. They see sick people too, like some of the sickest we share patients. But they don't see healthy kids. Yeah. Name a healthy kid that sees a cardiac surgeon, But, it's as simple as like putting in an ear tube. I probably put in 4 today. And then a couple days ago, we did a complete tracheal resection. Really bad narrowing of a kid's airway who was like 2 years old. We cut out maybe 50% of the trachea and had to release part of it going into the chest and bringing it together, and huge surgery.
Yeah.
So
I think if I can cut in, and you're the expert here, so we'll defer to you, but I know, as a student, as a pre-medical student, certainly, and then as a medical student as well, like a big part of medical school. And certainly I think one of the big things I learned as an intern is like, what is like really like a sick patient versus a not sick patient. Right. I kind of get into that. And one of the things that I think, as you are saying, is like pretty unique about ENT is that like an ear tube patient, we would say is not a sick patient, right? Like they have some issues with their eardrums, and I'm sure you could elucidate better than I can, but like they get frequent infections, I think, is usually the indication for those ear tubes. And so like, an ear infection, like you don't want to have them chronically, but it's not like an urgent, like this is a serious problem for you. Whereas like a tracheal issue, when you talk about like problems with the airway, like your airway has to be working, right? Like if your airway is not working, then you're going to not survive for a long time, right? And so like an ear tube problem is like, yeah, let's schedule your surgery for, 6 months from now when we have some time on our OR schedule. And so that would be a healthy patient, right? Like a non-urgent problem.
Right.
Tracheal issue is like, these are people who are like urgently sick, need the OR sooner than later, have to be able to breathe. And that's part of the like interest of ENT, at least in my estimation, is like, you get this variety of like, there's some like low acuity problems that are, pretty simple fixes like tubes versus like these big high stakes surgeries that take a long time and that
Yeah.
you're doing, I don't know. I mean, I don't know. What do you have any thoughts on any of that?
Yeah, I mean, I really enjoy that aspect of it. I think we've talked before. I came to understand about myself. I didn't always want to be with just sick people. That's just
Yeah.
something I came to the realization of. But it is nice every once in a while to take a really sticky problem and move that forward or help that person out, such a major impact on somebody's life. So whether we're trying to improve morbidity, this term about the quality of life versus somebody's life or death, we've discussed on the show before. It's something that each listener will need to kind of think through how much they want to be involved in each one of those things. And I do like that my specialty includes both. But it's been fun for that regard, kind of, it's nothing stale. It's kind of
Yeah.
bouncing back. What about you, man? What's last 24 hours in the life of a dermatologist?
Well, I woke up at 11:30 a.m. after I got my good. No, just kidding. No. I mean, I was just telling you, I've been going to the gym. So I wake up pretty early to go to the gym, which is nice, and
Yeah.
before we started, I said to Jayden, what time are you starting tomorrow? And he said,
Yeah.
I have to be in at 5, which is, not like the worst that anyone has ever had to do in the hospital, but it's not the best that anyone's ever had to do either. And we start at 7:15 with lectures every day, so I feel pretty spoiled as far as that goes. um, I do think I get up earlier than most of my co-residents. I think some of them like live right there next to the hospital and kind of roll in at 7:15. And I have been kind of waking up earlier and going to the gym, and then I get there a little bit early to try to get some things done. But it's nice to kind of have that luxury, because we don't start until a little bit later, and then we have lectures every day for an hour.
Every day. Wow.
Yeah.
Wow.
A lot to learn, I've been thinking about this too, because I knew we were going to talk, and there's just like, I think I've been thinking about like why it is that it feels like there's so much to learn in dermatology.
Yeah.
It's because I'm feeling sorry for myself, and I don't know what it is, but there are so many things. Like, I wonder if like there are kind of like minor pathologies in other organ systems that just don't get brought to light or don't get worked up as much, but because like people can see any little thing on their skin, like there's just a lot of variety, and there's a lot of like sub classifications of
Yeah.
diseases and like sub classifications and things that like don't necessarily matter for management even, but like things that we're supposed to know. And so there's a lot to learn, and I still feel like I'm very much drowning. Like, we're a quarter of the way through the first year for dermatology at least, and I definitely don't feel like I've got a quarter of dermatology even figured out at this point. So anyway, a lot of lectures, and then we have clinic pretty much all day, the rest of the day. Today I was I was in a clinic this morning, that was kind of like a general dermatology clinic, like very standard stuff, seeing a lot of like just honestly a lot of skin checks of like people who are coming in for their annual, or if people have skin cancers, they'll come in every 6 months depending on kind of how often they get skin cancers and what kind of tumors those are. But doing a lot of that. And then in the afternoon, 3 times a week at our program, we have like an urgent access clinic. And so like, you can call today, and if you needed, a skin check or had some sort of non-urgent problem, then we would get you in like, 4 or 5 months. But if you called and you were like, wow, I have this terrible rash and like it's painful, itchy and all this stuff, and I'm having blisters, then we would get you in, on Friday. So it's nice for patients, I think. But it ends up being really busy. Like they really pack the schedule. And today, I mean, usually, and you'll laugh because it sounds so cush. Usually we're done by 5. And today I was seeing patients till 6:15, which felt like It was late for us,
Get it
it
all
was
the
pretty
time. Yeah.
late. It was late for us. And yeah, people coming in with like, drug rashes and people coming in with like new spots that have popped up and new skin cancers, doing a lot of biopsies. And um, that was today, but it's day to day,
Yeah.
the days are all fairly similar, but we rotated a lot of different sites, and, have some different responsibilities and things. But
I'll tell you what, Eric. I was on call on Sunday and a lady came in with scars all over her face. All of, like they were potholes all over her face.
hmm,
And she had this new ear cyst that was basically taking up her entire canal. And she had seen so many dermatologists. And I had asked her, like, when would I have met you? Like, if I had met you a couple of years ago, would you have had all these scars? And she's like, no, this has all been something over the last couple of years. It's just exploded. But every time I get an appointment with the dermatologist, it's so far out that
hmm.
the lesion's gone. Like,
Well,
and they're like, I can't biopsy something that's gone away. And she came in with this fresh one with the ED, and I did not want to biopsy it because I'm like, I could run into some serious bleeding
yeah,
and not be able to manage this. But I'm like, this lady's been plagued by this for years and can never get into a dermatologist, like an urgent. Like what you're
yeah,
describing is
yep,
exactly what she needs, but she gets booked for a month and a half and it's gone,
yeah.
And so I'm like, I need to get this lady a biopsy so the
Did you do
dermatologist can
it?
know what to do. So I did. Fortunately, I did not run into bleeding, but if only that urgent
Did you
could.
did you follow up the path result?
I will. I put her on my list so I could follow because it's
Yeah,
very interesting.
yeah,
But I'll let you know. It's
yeah. I mean, sometimes I think that I might want to work in academics, and sometimes I think I want to work in private practice, and sometimes
mm,
I want to open a practice. But I think, and I won't mince words. Like these urgent clinics are they're kind of a drag. Like they're so busy. Like I cannot describe. We're just like sprinting around from room to room because there's so many patients and like there's just so much to do.
yeah.
I think it's really valuable. Like I really, exactly for the reason that you're describing,
Hmm.
and it happens to us all the time too, that someone will say, "Oh, I had this problem and I called to make an appointment. It's been, 2 months and now it's gone." And what do you do in that case? You
Yeah.
say, "I'm glad it's gone. If it comes back, give us a
Let us
call."
know. We'll
And
schedule you another
we're
two
usually
months.
better when someone is established about getting them in sooner.
Right.
But still, I think, wherever I go, I think I'll be an advocate for the urgent. And yeah, I think you have to have good individuals like triaging
Mm,
who's going to come to the urgent clinic because sometimes we get, someone who doesn't really need to come to the urgent
right.
clinic. You know what I mean? And so you have to be good about who's coming in and like who's having these sorts of issues that are kind of transient in nature and more acute. They need to treat sooner than later. But but yeah, it's been interesting, I think I am interested to hear like how you're doing it all. Like we've done a couple of days. We do our consult months as PGY threes,
Hmm. Oh. Hmm.
and we all do 2 months. And UAB hospital is like it's like a top 10 sized hospital, like one of the larger hospitals in the US. So there's like a lot of ground to cover. I'm sure like you guys cover multiple
Hmm.
hospitals. Like we cover a few different hospitals as
Hmm.
well. And like we've done a few days of like kind of tag along with the consult resident, like see what's what and try to figure out how the inpatient side works because none of us did our intern year at UAB, because
Yeah.
we all did a separate intern year. So it's all kind of new. And every time I go out with them, I'm like, this is so complicated. And you're doing that and like seeing the peds consults and being in the OR, like it's more than I don't know. It's like I can't even figure out how to just do consults. And the idea of having to do consults and be in the OR, like at the stage that, we're at the same stage and we push it off another year. You know what I mean?
Yeah.
I don't know. How have you been able to like kind of confront some of these like big tasks head on, like some of these heavy responsibilities. Cause I feel like I'm kind of cushioned from some of that, which I'm
Yeah.
grateful for. And it's nice to be able to ease into it. But I don't know, like what is your strategy been? How have you been able to deal with all that?
Um, some moments dealing with it well, others not as much as I'd like, but I think I've had to realize that I can't get to everything. And I guess I'll give somewhat of an analogy. Anytime I go to like a hotel room, I have this paralyzing fear that I'm going to leave something behind. I think we all probably experience that because when you leave a hotel, it kind of feels final. Like
Yeah. Yeah.
I'm going to give my key away and whatever I left my room, it's gone or whatever. But for me, at the end of the hotel stay, I always kind of tell myself, like, what are the things that I can't replace? I'm going to focus on that. And if there's anything else that doesn't fall on that list, oh well, like I can replace it. It's not that big of a deal. If I leave my toothbrush, which I have, literally on step 2, step 3, when I took it, I had to go to a hotel and I lost my like electric toothbrush that I had spent like
Oh man,
$60 on it.
brutal.
Yeah, it was sad. But at the end of the day, it wasn't my passport. It wasn't my keys. It wasn't my phone, So those are the things I spend the most time thinking about. And I just realized sometimes I'm going to leave the electric toothbrush, and that's okay. I can replace that. And I think with my current responsibilities, that's what I've had to kind of use to get through it. I have so many tasks on a given call shift, so many tasks. And there's a part of me that knows like I will not get to everything. But what are the things like I cannot miss? Like if I miss them, it is going to severely impact somebody in a negative way. And those are the things like I'm actively trying to manage. And if I catch a breather, which sometimes I do, I go back to some of those more silly things. But I try my absolute best to focus on the things that I just can't miss.
Yeah.
And that has been a really great triaging tool for me. And it just helps me feel a little bit better when I am falling behind, which is inevitable in residency. You will feel that way. You'll feel that way as a med student, But if you're really keying in on the most important things, it's going to be okay. Like, for example, I got 15 phone calls on Sunday from patients and patients' parents about various ENT problems they were experiencing. But it was literally the lowest priority after I kind of triaged what they're calling for, when I was getting 5, 6, 7 consults back to back to back for facial trauma. And then I had a patient that was Cody. Like those were the things I was focusing on, and writing the note for the patient who had a tonsillectomy, who has some pain. Like I talked to the family real quick, but I'm not focusing on the note. If it doesn't get done, it doesn't get done. Sorry.
Yeah.
And so I think that's kind of how that's been my approach to getting through all this. It's just, realizing I'm not going to be perfect, but I am going to get to the things that matter most, if that makes sense.
Yeah.
Long-winded way, but sorry.
No, it's interesting to hear, the priorities are just, the priorities are different. I think the priority is like appropriate patient care and like making sure you're taking care of people well. I haven't done any call shifts yet. We start taking call next month, actually. I think in 2 weeks we start taking call, and we do it a week at a time.
Oh yeah.
It's mostly like it's nights and weekends kind of call for us. And so like, if a consult comes in,
you guys don't come in. Before you tell us, I have to tell you, I literally got called to the ED for like a little abscess that dermatology refused to come in and drain.
That sounds about right.
They're like, unless it's Stephen Johnson's, they don't come in.
I mean, even then, it depends on what time it is. If it's 4 a.m., we'll just push it off 2-3 hours. It's not going to change management. At the end of the day, that's really what it's about. Like, it's not like we don't want to come in. per se. It's that like, are we going to change management right now? Because a lot of the time when you call dermatology, and we don't have to really get into this, but a lot of the time it's like, yeah, we would appreciate your thoughts, but also like we really need you to do this thing. Like we need you to biopsy this thing because we are not sure what it is. It's like, yeah, I can come biopsy at 11 p.m., but also like they're not gonna process it or read it until at least, they're not even gonna give it to the pathology techs until tomorrow.
Yeah.
And they probably won't get the slide until the next day. You know what I mean? So like, do I have to come in at 11 p.m. and do it? Probably not. But like we field a lot of phone calls, I guess
Yeah.
is what I was going to say. And so it's interesting. You're like, that's like the lowest thing on my list.
Right.
And we're on call, we get a lot of phone calls as well.
Mm-hmm.
But that's like, it's phone calls. And then we'll come in either Saturday or Sunday usually and like kind of round on all the consult patients. But a lot of our patients are more stable, and like the pressing medical issues that need to be resolved right this second are being taken care of by other teams who have kind of more acute training. And so it's definitely lower acuity. And like a lot of our higher priorities and concerns are like making sure we, document our thought processes about the pathology that's occurring so that the primary team has an idea of kind of what's going on and what our recommendations are. Making sure that we call back families and things like that. There's not as much my patient is coding and I have to go to the bedside now. So just kind of a different set of responsibilities, I guess. It's interesting to hear.
Yeah, it's a dynamic. I feel like every specialty doesn't. I think it's important that we exercise a sense of humility. Like I don't really know what somebody else is going through. It's very easy to feel jaded that somebody calls you for a problem that you think is so simple and it's just bogging you down. But then if you take a step back, it's like, well, you went into the specialty and because of that, you know a lot more about it. And a lot of people don't know about what you do. Like we get called to place a Dopphoff all the time. And if you ask any ENT resident, we're like, did you graduate med school? Like you put it in the nose and you push.
Yeah.
But you'll have people who graduated medical school who like you'll hear the term call themselves doctors and will not even try. But then, you really sit down and think about it, you feel like they're just not familiar with it. They don't know, they have expertise in other things. But yeah, it's just a different dynamic. Every specialty is different. The amount of the relationships with the patients are different among specialties. I think it's all great, but it's easy to feel frustrated and jaded amongst this entire process of medical training, So that's another piece of how it's very easy to feel that way. I don't know if you guys ever get that. Do you feel that way? I mean, like some of the consults you guys get,
Like
it can
why
be
are
a
you
huge
consulting
burden.
us?
It's a kind of a burnout sometimes when you're getting overloaded with things that you feel like you shouldn't be getting overloaded with, whether it's calls or other teams. I mean, this is an important part of medical training, even for our pre-med students listening. Like, how you deal with that is important.
Yeah, we feel that way all the time. We have a policy of, we have a policy to finish what I was going to say. We have a policy of seeing any consult that gets called into us, and so even if it's like something that we think is really straightforward, like you need to put moisturizer on that, that's our recommendation. Like we'll go see it and we'll make an assessment and write a note and give the recommendations.
That's great.
But I do remember, and you said like to stay. I'm just thinking like I was going to ask you kind of what like overarching lessons you feel like you've learned, not necessarily on consults, but just in general in the last maybe even year plus. And I was just thinking about this. We had this one surgery resident, and surgery residents, and you're a surgery resident, I guess, but a general surgery resident. I think you guys can have a reputation of being like kind of what's the word I'm looking for? You know what I'm talking about. Kind of like condescending. For lack of a better word. Like that's maybe a little bit. But kind of like you're like, you should know this, you should do this
Yeah.
yourself, like, stop calling me, sort of thing.
Yeah.
And there's one surgery resident, he might still be there. In fact, I won't say his name just for the sake of privacy, but he may still be at Michigan. And he was like famous around the hospital for being like super friendly and super helpful, like all very humble, very willing to help, even if it was something like, even if you just wanted to like ask him a question offhand, he was like, he was very knowledgeable and he was very helpful. And I remember I rotated with him when I was, I guess, a second year medical student, probably. And I remember I was like, I'm going to be like this guy. Like, this is like, this is why you want to be a doctor, is like to help patients and to help other people care for their patients, And I think it's easy to kind of lose sight of that, and you get burned out and you get worn down. Whether it's in the hospital or whether it's in clinic with your own patients in your own day. But again, just like you said, I think, taking a step back and recognizing that you have something to offer because of your education and training, and, that's a blessing to someone.
Yeah.
If it feels, straightforward for you, that's like something that might actually really help someone else. So that's something I've tried to remember. And, I haven't been consulted very much. I actually did consults as an intern. I did medicine consults. So it's like patients who were admitted to ortho.
Oh man.
That needed like blood sugar management and things like that. And but yeah, like the principle is the same, like where you have the opportunity to help or the ability, and you should make the most of that.
I think this is another salient point for the pre-meds listening. I had a preceptor at the beginning of med school as a first-year med student when I was in her clinic, kind of as the primary care longitudinal experience. And I spent 2 years with her. I got lucky enough to get paired with her for a second year. So we became really close. And I remember it was like one of my first days with her. She mentioned to me, like, it was kind of a warning, maybe some cautionary advice, that most of the students who had passed through her clinics over the years, and she's toward the end of her career, she said, like, most students come through my clinic as first years, having more empathy and understanding of patients than they do throughout the rest of their career. And her goal for me was to never lose that. And I frequently think about that comment, especially when I'm starting to feel jaded or upset about something. But I hope that people listening kind of realize this bitterness and this feeling of not being happy in the hospital or feeling disgruntled because of a patient, what they say or do, or another physician or nurse or whatever. Like, this starts as pre-med, or I should say probably medical students. It's not just in residency as we're describing, but you can become jaded very quickly and have really bitter feelings if you let that happen. And it's important to take time, whether it's on a bus ride home or at the end of the day or beginning of the day, to just be mindful of that. And I'm not going to give a prescription on how to fix it, but I think just taking the time to recognize it is a really good first step, because it's really easy to feel that way, even as a med student. I don't know if you've ever felt that, Eric, but I don't think it's just unique to residents,
Yeah, I think it probably gets passed down, kind of. You see it modeled. This is an MCAT topic, right?
Right.
Modeling.
Modeling, exactly.
You see it modeled in your, in your superiors and in the residents that you work with as a medical student, and in the attendings that you work with as well in some cases. And so I think it's easy to pick up this kind of like nonchalance when it comes to other people's suffering. At the same time, Jayden, I think a little bit of it is kind of a defense mechanism, or maybe that's an inappropriate use of the term, but like you really can't be 100% empathetic with every person who comes in the door. Like you just don't have the emotional capacity. And one thing that, I've seen really on the dermatology service, honestly, uh, has been like some attendings, specifically on consults, as a matter of fact, that like, if it were me, I would walk in the door, I would say, what's going on? I would get like, a 2-minute history, and then I would say, okay, we're going to do a biopsy and we'll let you know.
Right.
And I will do it and get out of there. And I have a couple of attendings who will go in and just like sit and just listen for 15, 20 minutes, which is like
Yeah.
unheard of,
Crazy.
on a busy service. And part of me is like, this is taking a long time, but more of me is like, this is therapeutic for these people.
Mhm.
This is important to them. They know that we're hearing them and really paying attention. And a lot of times, in a field like dermatology or infectious disease, some of those things that come out during those conversations are actually really important to the kind of
Mhm.
diagnostic workup that you might provide and things like that. But I think I agree with you, Jayden. And I think that's kind of, I don't know if there's a right answer of kind of how to combat that. And again, I don't think that you can be, I don't, maybe this is not a great take, but like, I just don't know if you can be 100% on and feel empathy really deeply with every patient, because I don't think we have enough time. I don't think we have enough capacity in
No.
ourselves. But, to be mindful and to remember to try, because it is really easy to get jaded. But Jayden, let's
Mhm.
pivot just a little bit.
Yeah.
This topic. We wanted to talk a little bit about maybe something that's perhaps a little bit more applicable to a pre-med student.
Mhm.
And I was talking with, I wasn't talking. There are some pre-med students who are like have like employment capacity in our clinic, and they do like they're either scribes or they work as kind of patient techs and things like that. So I talk with them on occasion, and like some of them are applying right now, and they're like getting some secondaries back and scheduling
Mhm.
interviews and things. And one of them said the other day, they were like, "Yeah, being a pre med just really is not for the faint of heart." And I kind of laughed because I was like, "Yeah, I mean, it doesn't really get that much better." But at the same time, I thought like it's true, like there's a lot going on. It feels like a
Yeah.
lot of pressure. And I feel like, and then they asked me this actually. They said, what is worse, applying to residency or applying to medical school? And I
Mhm.
said, for me, it was applying to medical school,
For sure.
because once I got in, it was like, now I'm in. And if I get to do dermatology, that's great. And if I don't,
Mhm.
then maybe I'll reapply and try again, and maybe I'll do something else. But I have the MD, and so
I'm gonna
I
be a
have,
doctor.
the
Yeah.
credential, and I can do something. Whereas when you're a pre-med, it's just a stressful time. It's so many unknowns, and I don't know what your experience. I can't remember, but I'm like kind of first in my family to go into medicine, and so
Mhm.
it was a lot of like not really knowing what to expect. And so in such a stressful time when you have so much going on as a pre-med, as a medical student, as a resident, certainly, um, what have you learned about yourself and how you can
Mhm.
like take time to, I don't know, like make time for yourself or make time for balance? Like, what does that look
Mhm.
like across these different time periods?
Gosh. First of all, I echo entirely. Applying to medical school is so much more anxiety provoking
It's
than
bad, you
anything
know?
else. I literally remember sitting with you in PD bio, or it was not PD bio. It was oh, my brain is not working at the end of the day, Eric. It's important that I remember this. Evolutionary biology, that's what it was.
Oh yeah, I forgot that we had that together. I
I
was
remember
gonna
sitting
say,
next
we
to
had class.
you, one of our other friends, Jordan.
That was a great class.
Yeah, but I remember it being so, it was at the time where we were trying to make big decisions about our lives. And just remember how much anxiety was surrounding the experience as a pre-medical student. And we were at least pretty happy with where we were at that point, but
Yeah.
it definitely brings up memories of feeling just pulled in so many directions that I think gets a lot better in medical school and beyond. Like I don't know, as a med student, I wasn't thinking about like, oh, I gotta go volunteer for this, and
Yeah.
oh, I gotta like network here, and oh, I have to like start, TAing for this. It was
And
just so much stuff.
it's such a stepping stone being a
So
pre-med. Like
much.
you are just not quite close enough to like what you really want to be doing.
Yeah.
And in medical school, you're not doing, ear, nose, and throat surgeries as a medical student. So at a
Hmm.
certain point, you're kind of like, well, some of this is not an ideal use of my time because it's not
Yeah.
what I want to do for the rest of my life. But at the same
Right.
time, like you're infinitely more involved in
Yes.
what is interesting to you than you were
Yes.
when you were taking evolutionary bio, which again was a great class, but is, less relevant in a lot
Right.
of than what you're doing in medical school.
Right. And I don't know, it's an environment where there were so many people gunning for this goal of getting into medical school, and to answer your question, I think an important aspect of this is not feeling bad if you don't fit the mold of whatever's around you. I don't think that leads to great wellness if you're going home at night realizing that you don't do things the way your evolutionary biology friends do, or there's not just one recipe to get into medical school. And it's hard in an undergraduate environment to feel safe to kind of pursue your own path. Um, and with that said, I think it's important to realize that you can't always make time for yourself. Like, I don't know if there's throughout your 4 years of undergrad or five or whatever you do, there's not going to be 5 straight years of always having balance or always having wellness. There's going to be some grind moments.
Yeah.
There's going to be moments where you're just not finding time for yourself to do the things you enjoy. But I think as long as that starts to even out a little bit, right? Because you might find a little bit of a break, maybe a lighter semester, or maybe dedicated time for the MCAT where you can actually build in that time. Like, I think as long as you're holding to some of those experiences that will come, I think it makes for a more enjoyable experience. Like for this last week, for example, I think it happens in residency too. I was chiefing the service for our peds ENT team because the PGY5, the chief resident, was gone.
Hmm.
And so it was on me to do that. I logged like 130 hours this week, but I knew like there was an end to it.
Yeah.
And this next week is so much lighter, and I'm going on vacation in a week. And so it's okay that I had a really, really rough week. It sucked in the moment. Don't get me wrong, but I think trying to find ways when you're outside of those grind weeks or months sometimes, trying to build something when you actually can is important. Like take a vacation, take a day off, but to have the expectation that you're every week of undergrad, you're going to be able to exercise or you're going to be able to go hit the golf balls at the golf range, that's just not going to happen. It's just not
Hit
going
the
to
golf
happen.
ball at the golf range.
Sorry,
You are out of it right now.
I'm out of it. Going to the range to hit some balls.
It was a good
You know what
try.
I mean? You know what I
Yeah,
mean?
yeah, yeah. No.
Expectations are important.
Yeah, I don't disagree with you, and I think I don't know if I'm like really the best person to commentate on this. But I agree, I think I'm actually a big believer that like and it's funny because this doesn't apply to me nearly as much as like any other resident, but I'm a big believer that like you have to do hard things and like stretch yourself to get to a point of betterment, you know? And I say the reason I qualify is because like I think a lot of ways you can think of residency in that light, like you're really doing like working 130 hours in a week. Like that's not something that a normal person would choose to do or even really be able to do at all. And so like, you do that and now you're better for it. Like you might not notice it, but you are a better I think, and people disagree with me probably, but I think you're a better doctor for having done that. Like more about your limits. You got experiences during those hours that you wouldn't have otherwise had. And you did something really hard that now, the next time you have to do something hard, imagine you have to chief that service again. You can be like, I did that. I've done hard things before. I can do them again. Maybe you have to stay up late and operate. And, in another circumstance, you might think, I don't know if I could do this, but you just put in all those hours. You did something really hard and,
Right.
and you built something in yourself by having done that. And again, like, here I am rolling in at 7:15 saying that, but I do believe that, and I think you have those experiences as an undergrad, as pre-medical student, you have those experiences in med school too, and you have them in residency. And I think, I don't know. I mean, maybe Jack Weston will not appreciate me saying this, but there's a scripture in the Old Testament that says there's a time and it's like Ecclesiastes something, and it says like there's a time and season for all things, more or less, paraphrasing. I don't think this is a bad thing for Jack Weston who's listening, because it's like, it's literature. And I believe that, like there's seasons, just like you said, Jayden, there's seasons where you are able to recharge and make a lot of time for yourself. And there are seasons where I think you have to like trust in the difficult moments and trust in what that's going to provide for you in the long term. And maybe this is just me coping, maybe this is the two of us coping that residency and medical school is hard. Because at the end of the day, like you're going to do hard things. You're going to have to kind of put your head down and push through some things. And there's not a lot of way around it. And I think it's helpful to go in with that expectation. As far as like real practicality of wellness and like self-care and things like that, to me, it all centers on like figuring out what recharges you. And what are you laughing at?
It's I had a counselor in med school. We had a meeting and she asked me, because I was doing really well, and she's like, you have 2 kids, you've done so well here at Harvard, how do you do it? And it just came out within seconds. I just said it and I didn't realize they said it because it sounded kind of funny, but I said I watch a lot of Netflix.
The obvious answer.
But there's truth to it, because that literally is something that recharges me. Yeah. I love TV. And if it's, if I'm going to wake up early and study extra, go to school, and I find a little bit extra time at the night, it's going to be watching Schitt's Creek or something funny on TV, that getting one episode in before bed recharges me. And so when you said that, I'm like, yeah,
Netflix.
For people it's Netflix. For others, it's probably something more meaningful, like Eric,
I think people will appreciate that though, Jayden, because it's relatable. You're like people are listening to this and they're like, Jayden Garcia, like the guy is just, I don't know how he does it. Like he's so different from me. He's built different. And people are going to hear that you recharge with Netflix, and they're going to be Netflix. Like, I can do it too. If Jayden is doing it based on Netflix, then I can do that.
I can do it.
Yeah, I don't disagree. And I was telling you earlier that like some of the med students who have rotated with us and things have been asking me like, oh yeah, what do you do like for fun? And I'm kind of like, I mean, and I'm not nearly as busy as you are, but like I get home at the end of the day and like, I work out a few times a week, and then, I study for an hour or two a day because we have a lot of textbook to read.
Yeah.
And, I try to spend some time with my kids if they're awake. And like, like maybe I'll make dinner a couple nights a week. Like that's enjoyable sometimes. And maybe I'll go for a walk. Like, I don't know if I really have hobbies, but it's like some of those little things, like reading a book to my child. And that's maybe not as relatable as Netflix. And sometimes that's recharging and sometimes it's not, depending on like what kind of mood she's in.
Depending on how the book goes.
Exactly. Yeah. But I think, you have to find some joy in some of those little things. I think for me, it comes down to expectations. And like you need to set expectations with yourself of like how much you're going to be able to do. That's like the thing that you want to be spending your time on.
Mm-hmm.
Because to a certain degree, and again, I think popular opinion in medicine is trending away from this. So maybe this is kind of a traditionalist and outdated viewpoint. But to a degree, like you're going to be a doctor and it's demanding. Like there's a lot that is required of you, and like people are going to be calling you and they're going to be in your inbox, and depending on your specialty, like you're going to be fielding calls or you're going to be going in for an urgent surgery or whatever. And like, you just won't have as much flexibility as someone who works just a straight 9 to 5, And so I think you have to find joy in that, in your ability to help people. And you have to find joy in some of those other things. But also recognizing that like, you can't maybe go fishing. Like I would love to go fishing every night, but I don't have time for that. So like you can't spend quite as much time on some of your hobbies as you maybe would want to. But I don't know. I mean, I think we could get like, if we had, 6 or 7 different people in this meeting, in this call right now, like I think we'd get all sorts of different answers on this.
Similar overarching principles, different ways to get there for sure. I think as you mentioned, everybody who's listening to this has chosen a career path that's very unique. And yeah, you probably for a long time are not going to be able to go fishing every night. But there's also some amazing aspects to the kind of path that we've chosen that maybe other careers, either later down the road or even, I'd say even in residency, for example, I get post-call days. I work at 24 hours, which the average person isn't going to do, but then I can go do stuff with my family at 1 a.m. or 1 p.m., like I take advantage of some of these differences of medical training, there's a lot of great opportunities to go. I'm going to a conference in Miami in 2 days, right? There's a lot of wellness to that.
Yeah.
Not everybody for their job gets to go present research and have everything paid for. And that's not unique to me. That's very common in what we do as physicians, So I think trying to really maximize those experiences as well is helpful.
Yeah. I will say, on the topic of the MCAT, and I know we wanted to move away from the MCAT for one episode and kind of give you guys some thoughts from down the road, but we're talking about like self-sacrifice and whatnot. I think that applies to the MCAT, but I also think, the MCAT's such a marathon that I would certainly not encourage anyone to like give up on all of their things that they love while they're studying for the MCAT, because like Jayden was saying earlier, like you'll have periods, like I'm thinking about in med school, and I think we've talked about this before, but like, in med school, you do different like rotations. You spend 3 months on surgery, and then you spend a month on psychiatry, and then you spend a month in family medicine. And like, when you're doing your surgery months, like you're really busy. You're there all the time and you're studying for an exam that happens at the end. And then you do your psychiatry month, and like it's office hours, it's like dermatology. And so the hours are not nearly as bad. You get to sleep a lot. You get to sleep an appropriate amount, right? And you would have some more time to go fishing every day or whatever the case may be. And so you have these like periods, and you have periods where you're really busy and periods where you're not as busy. But when you're studying for the MCAT, I guess depending on how long you're studying, but I started in September and took the test in May. So it was, what is that, 9 months, I think, 8 months, 9 months. And like, you can't just give up on everything that you enjoy for 9 months. Even if you're doing it from January to April, like that's too long. And you need to make time to do things that you enjoy. Now, do you need to prioritize your enjoyment over studying for the MCAT? I would say no.
Mm-hmm.
You got to get ready for the test. But while you guys are studying, it's September when we're recording this. So like, the year what year did we take the MCAT? 2018.
I want to say it was
So it was 2017
17.
September when I started studying.
My wife's saying 18 in the back. I trust her.
Okay,
Must have
18.
been 18. Yeah, I think it's 18. I think she's
6 years
right.
ago. So it was a handful of years ago that we were studying, that I would have started studying in September. So some of you guys might be starting right now. And like, you can't give up on everything until April or May. It's too long. You got to find some joy in the journey.
Mm-hmm.
You gotta self-sacrifice a little bit, but you got to find ways to make it bearable. Because the MCAT is certainly a marathon and not a month or 2 month long sprint of studying. I don't know. Do you agree? Do you disagree?
No, I agree. Yeah, I think at least the way we approached the MCAT, I remember we kind of ramped up, starting in the fall.
Slowly.
It was pretty minimal. And then so we probably had a lot more wellness time there.
You're right. It's a good point.
And then we hit it probably a steady state of like, we knew exactly what we were going to put in every week. And then it got closer toward the summer. And I remember we did like that blitz at the end, which I think I recommend in some ways, no matter how you do it, just really going hard for the last, like that final push. It's like turning the corner in the 400-meter race, right? Like it's the final one. And of course the wellness wasn't perfect then.
Yeah.
But then you took the test.
That was a month, right?
It was a month. You just do it. But then the test is over and then so yeah, I think that's kind of the message we keep interweaving here is like, it's a roller coaster. There are ups and downs, and there are times where you have more opportunity to practice wellness, and there are times when there are less, and that's important to just it's important to know the expectations of that going into this. So.
Yeah. Well, next time we see you all, we will return to a more MCAT centric topic. But we want you guys to know what you're headed into, and it maybe not for some, but I always felt like the next step was always kind of a black box. And so it's important to me to kind of make our experiences known so people have some idea of what they are kind of coming up to as they get to the next step and to the next step. But we think about you guys, and we hope your studying is going well, and we encourage you to have good spirits and to keep up the good work, because it's certainly worth it, at least from the second year resident standpoint. Dan, do you have anything to add?
No, that's great. Thanks, Eric. Thanks for having me. This is awesome.
Yeah, thank you guys for tuning in, and we will see you next week. Until then, happy studying.
Take care, guys.